When I think about sports medicine and what they provide for us at Thomasville Physical Therapy, I mean, there's got to be a balance of getting the athlete back out on the field, because that's what they want to do, but we got to make sure that their best interest is in mind, that the appropriate amount of time is set aside for the healing process and the therapy that goes along with that. Because they do such a great job of balancing those two things, we've built a ton of trust over the years.
I tore my labrum, but we didn't know it was torn, so I pitched my whole freshman year with torn labrum. I had the surgery, and then for a month straight I had to stay in a sling because I also had cartilage damage on my shoulder. I really wanted to get back on the field, but I also really wanted to be able to pitch again, and that was one of the main problems, was being able to pitch without pain.
Dylan had his injury, the labrum tear. He does want to go to the next level. He's making preparations for it now as we speak. But I needed someone who would invest in him. I knew that when we walked in and we talked to Earl and we had Brittany day one, we made the right decision.
Well, Caden's been pitching since he's been 8 years old. Well, he was pitching, he came home and said his fingers were tingling a little. I told him don't throw another pitch. He had a scope and said that there was nothing tore. Caden wanted to pitch his senior year. That's all that mattered, he wanted to pitch his senior year. And Dr. Earl always assured him that there was nothing tore. We're just going to adjust that shoulder down and you're going to be fine. We're just reassuring that, you know, that they cared about him. I mean, that could have been the end of it. I mean, you work and you work and you work all these years, and all of a sudden, you know, that could have been the end. He ended up getting a scholarship. Dr. Earl, I still text and talk to him quite regularly, let him know he wants to know how Caden's coming along, how he's doing. He congratulated him on his scholarship he got. After the therapy and after the throwing program, he said, "Daddy, my arm feels better than it ever has."
I believe if it wasn't for the relationships, I probably wouldn't have recovered as fast, because it was a hard process, and they were there to constantly support me, and like I would come in and I would smile, and it was a good part of my day.
I think it's important, whether you're a school with 500 kids or a school with 3,000 kids, just having somebody that you can trust to go through that process with is just really, it's huge.
Physical therapy is a requirement, but they took ownership and they took his dream and they helped him get back to it. And that's what really mattered the most.